my name is Lee Taylor. I'm a physical therapist here at Loudon Sports Therapy Center, and I'm going to be talking to you a little bit about plantar fasciitis today. So to begin, what is plantar fasciitis? Plantar fasciitis is a fancy word that essentially means pain at the bottom of your foot. It typically is either in the heel or the arch of your foot. Next, we'll talk a little bit about the symptoms. So the symptoms of plantar fasciitis are, again, pain at the bottom of the foot in either the heel or the arch of the foot. Oftentimes what you might be experiencing is pain that occurs after you have been off of your feet for a while. So your first step out of bed in the morning or first few steps out of bed in the morning can be usually the most painful, or if you have a desk job where you're sitting and you're off of your feet a lot, and then after a few hours of working you get up to go, take a bathroom break or get some coffee, and that's like, ooh, I feel the discomfort then. It's not so much when you're at rest. But also, it can also be if you're on your feet for a prolonged period of time, you can start having, the longer you're on your feet, the more pain you'll have, and then you might also have the other two symptoms as well. So those are the main symptoms that occur with plantar fasciitis. Reasons why plantar fasciitis happen are that oftentimes we increase our walking or we are wearing shoes that aren't very supportive, but other times it can be the type of foot you have. So sometimes people have what we call flat feet, where they don't have a nice arch to the middle of their foot. Other people can have a high arch, but also not only that they have a higher arch, that their foot is very stiff. So on one hand, with the flat-footed person, they're stretching out that plantar fascia, which is a connective tissue, and it takes on, instead of the muscles and the joints supporting the arch of the foot, they're collapsing essentially, and they're not doing their job, so the connective tissue or the plantar fascia is taking on all of that stress. On the other hand, with a patient who has a better arch but a more stiff, rigid foot, they can also get plantar fasciitis, in part because their foot is not a very good shock absorber. So because the joints in the foot, for whatever reason, a lot of times this is how we're built, you just need to work on maintaining the flexibility of your foot, but you have stiffer, rigid joints that cause the foot to, instead of take on the stress through the joints and muscles, that the stress gets put on the plantar fascia or the connective tissue, like I said earlier. So it's either one or the other. Next, how to treat the plantar fasciitis is a bit mixed. Obviously, it depends on the kind of foot you have. Like I was saying, if you have a flatter foot, there are going to be different treatments that usually include strengthening of the muscles in and around the foot. It can also be strengthening of the hips. It really depends on you. And then also we can work on improving the range of motion of the ankle and increasing the joint mobility of the small joints in the foot. There are also sometimes orthotics that can help, but again, it depends on the foot and it varies from person to person. So feel free to come in and see us and ask some questions. We'd be happy to do an evaluation and get you set up with the appropriate treatments that you need. Thank you.